when we meet a family and a patient for the first time, once we get past sort of that shock of this is your new life, right? You have this cancer or this bone marrow failure process that we need to intervene on and treat, and it's going to be a rough course. And there's a lot of shock that comes with that initially. And once we move past that, we start talking about the fact that we know how to treat this. We know what to do. We know how to fix this. And we know how to help you get from here to that better place. And that process then really is a conversation between myself and the treating team and the patient and the family, right? And we talk about what the options are for that treatment. And then we talk through, which one might be best for that child and that family based off of their own individual characteristics and their own family dynamics, like what's going to work best from that standpoint. And we really make it the family and the patient then part of that treatment team, right? It's not us and you, but it's all of us together. Parents and children have lots of choices in deciding where to pursue their health care. When it comes to cancer care, you want the absolute best that you can get for your kids. I would say Siteman Kids at St. Louis Children's Hospital does provide that absolute best care. We're leaders in transplant care, oncology care, hematology care for pediatric patients. No, there isn't a better choice, really. I specialize in doing stem cell transplant, so that's bone marrow transplant for kids with cancers or failure of their bone marrow or immune deficiencies. I get really interested in it because it's really a blend of immunology, which is sort of how the immune system works, and oncology. St. Louis Children's Hospital is one of the leaders and one of the initial people in building collaborative groups for treating pediatric patients, and we continue to build on that. But I think what's really exciting and what's really going to drive care of these patients going forward is the new advances in targeted therapies, which are specific to patients' tumors, either individual tumors or broad classes of tumors. And then also the new advances in immunotherapies that are really bringing a new approach to treating patients. Both of these things, individualized treatments based off of tumors, classes, and also immunotherapies, are really moving our ability to treat patients away from toxic chemotherapies to treatments that have less side effects and less toxicities, but better efficacy. So the opportunities to really develop these new therapies, the targeted therapies and immunotherapies, really stems out of this collaborative and close relationship that Siteman and Siteman Kids have with Washington University School of Medicine. The research environment that's there, it really provides a foundation for the discoveries that allow us to then push these treatments forward and these new and novel therapies to the forefront. And I would say, one of the most rewarding aspects of my job is actually to be able to, in many ways, sort of like a general pediatrician, right? Be able to follow these kids for many, many years. I have patients that I've met when they were infants and now have gone off to college and having their own families, right? And to be able to watch them not only go through this challenging process and come out on the other side as this healthy, vibrant person, but to watch them grow into these amazing people and human beings and watch the incredible things they go off to do is incredibly rewarding.